Well, the Center for Disease Control has stated more than 1.2 million people in the U.S. are living with HIV, and 1 in 8 don't even know. Here to talk about reducing HIV infections by taking different precautions, such as PrEP, we welcome now education and specialist at SUNY Upstate Medical University, Nikki Jennings, and we thank you so much for coming with us.
Thank you for inviting me.
Good to have you. So when we talk about this here, obviously the numbers are startling.
Yeah.
And we know that New York State is really trying to be aggressive about finding a cure and reducing the number of infections. And so we've got this thing called PrEP. Right. And I want you to take a few moments and just share with our viewers a little bit about PrEP.
Yeah, absolutely. So in New York State, we have around 3,500 new HIV infections every year, and we're trying to bring that down. So we have a task force working throughout the state to end the epidemic, and we're aiming to end the epidemic by 2020. So one of the parts to that is getting people who are at risk for HIV onto PrEP. So PrEP is pre-exposure prophylaxis, and it's a daily pill that we've got that's over 99% effective at preventing HIV.
And so, as it's out there right now, talk about awareness. So how many people are really aware of PrEP? And I guess that's the common goal right now, to make people more aware.
Yeah. I think there's mixed awareness on PrEP. I think there are some communities that have better knowledge of PrEP. I think typically gay men have a better understanding of what PrEP is and maybe where to get it. But I think one of the areas where we're seeing that the PrEP knowledge is not good is in our communities of colour. And we know that communities of colour are disproportionately affected by HIV. So we see different populations having different knowledge on HIV and on PrEP. On the whole, from my experience, young people especially have very poor information on HIV. And they really don't know how HIV is transmitted. They don't know what tools there are out there to prevent HIV, and PrEP is just one of those.
Is it the lack of information coming from the stigma? Is it that the people just don't want to know? What are we finding in terms of that?
Yeah, I think it's a combination of things. Luckily, we're in a place now with HIV that if somebody's HIV positive, they're going to live a long and healthy life as long as they're on treatment. So HIV is not as visible as it used to be. You know, in the 80s, early 90s, it was much more visible in the communities. You know, it was something that you couldn't forget about. And so people were a lot more afraid of HIV. So I think with the wonderful developments that we've had in treatment, I think one of the challenges there is that particularly young people, they don't remember the beginning of the epidemic. And so they don't have the knowledge, they don't have the fear of HIV. And I think partly there's stigma, you know, still associated, and people don't want to talk about HIV. I think that certainly is a factor. HIV isn't being, there's not enough education in schools about HIV, sexually transmitted infections, and so I think it's a combination of things.
So give us a little bit about New York State, because New York State and the governor has a real aggressive plan in terms of dealing with HIV and AIDS. Bring us up to speed with that.
Okay, so it's a 3-point plan. So Governor Cuomo has come up with this blueprint to end AIDS by 2020. So 3 points to the plan. We want people to get tested. So we really encourage people to get tested at least once a year, regardless of what they're doing, how high or low they perceive their risk to be, a test every year. So that we can find the people who are HIV positive, get them onto treatment, and with that they will do much better, they will live long and have a very healthy life. But also they're much less likely to transmit the virus to somebody else, which makes sense. If somebody knows they're HIV positive, then they're much less likely to give it to somebody else. Also, while somebody's on treatment, if their viral load is suppressed, so that means that the treatment's working, there's very little virus in the blood, the chance of them passing the virus along to somebody else is it's slim to none, which is fantastic. So we want people to get tested. We want people in care. So those people who are HIV positive, we want them on treatment. And there are many people out there who are HIV positive, but for a variety of reasons are not in care, they're not taking their medication. So we want to connect them back to care to reduce transmission to other people and keep them healthy. And the third part is PrEP. So finding the people who are at risk for HIV, and we want to get them onto PrEP. We want to get them taking this daily pill before they become HIV positive and bring that number of 3,500 new infections in New York State down to 750.
Which brings me to my next question. There's a new breakthrough that came out, Jerusalem HIV breakthrough. Give us a little bit of...
So, a cure for HIV, there have been some promising developments, But it's important that everyone knows that a cure for HIV is not around the corner. So there is research all the time going into a cure for HIV, but it's not something that's going to happen within the next couple of years. The way that we end this epidemic is through prevention. That really is the key. That the cure it's not going to be something that we see soon. So the key with HIV now is we need to prevent it. We need to make sure that we're bringing down the number of new HIV infections, and PrEP is a fantastic way to do that. We really want people to embrace PrEP as a very positive, healthy way to prevent HIV, taking control of your sexual health, making choices that keep yourself and others safe.
So for those people who've been exposed to finding out about PrEP, and you've been out there on the front lines really making people aware, what's the reception been like?
It's been mixed. We have had, certainly a mixed response. So you would think that this would be, it's hard to sometimes think of a kind of negative take on this, but there are some people who have concerns that with PrEP being out there, that people would be less likely to use other protection methods like condoms. So that we might see a rise in other sexually transmitted infections. There's not any evidence yet that that's happening, but that's some of the concerns that when we're educating on this in the community, that's what people are saying. In some cases, yes, it prevents HIV, but it's not going to prevent things like chlamydia, gonorrhea, syphilis. So that's one of the things that we hear. And I think on the whole, some people are a little bit cautious about taking a medication when they're not sick. The flip side to that is we want them to take the medication before they get sick. That's what we're trying to do. HIV is still, it's a chronic illness now, but it's certainly a serious illness. So it's important that we prevent it, and we step in before somebody becomes HIV positive and prevent them having a lifetime of the challenges that come with HIV.
Nikki Jennings, our guest here. Thank you so much for coming and sharing with us. Talk a little bit about PrEP. Of course, we want you to stay connected to us. She's also going to be a guest on Perspectives, and you watched Perspectives, you'll find out more about PrEP in depth, and Nikki will break it down a little bit more for us. Thank you for coming.
Thank you.
All righty, let's take a quick break. I want you to stay tuned. There is more show coming up right after this.